Apple and Fitbit are turning to healthcare as a way to win big in the smartwatch space, especially when it comes to the data involved. Let's start here, Larry, with Apple and Fitbit and what they're looking to do.
So if you look at Fitbit came out with earnings and they highlighted for the first time that their healthcare unit, which is a B2B operation that caters to healthcare plans, enterprises, things like insurance, basically trying to get the employee base healthier. And they revealed that they're looking at $100 million in revenue in 2019. And that was the first time, like, Fitbit's been on this strategy to basically wean themselves off hardware sales, because that's a very hard business, and integrate themselves more into the healthcare system and use their data to create new services. So what you see is basically Fitbit's moving from being a hardware company to being a data and software company too. And Apple's doing something very similar, right? So they have the Apple Watch, which is much broader, but you're seeing them cut deals and be FDA compliant and add, things for diabetes and all these other sort of deals with health insurers too. So at the end of the day, Fitbit and Apple are kind of in a race to aggregate as much healthcare data as they can, and then do additional services on it. So it's very interesting to watch. So while they compete on smartwatches, I think the real battlefront's going to be in healthcare.
So, of course, Larry, data definitely king, especially when talking about the healthcare sector. So just talk a little bit more about the value of the data that they'll be getting off of these smartwatches.
Well, right now, Fitbit kind of has the lead in terms of the data race, right? Because they have 27 million active users. They have, trillions of hours of sleep data. They have things on heart rates. They have, on an aggregated basis, they have just more history in terms of tracking health. And that data is increasingly critical because they can use that and then they can create additional services. So the other thing Fitbit's doing is launching a subscription service for consumers. So that's going to be interesting to watch too. So as this data comes, and if you look at the healthcare system with electronic records and how people are tracking more of their health, it's that whole quantified self movement. Fitbit's sitting on a very nice chunk of data. And I think that really gives them, certainly gives them enough leverage to sort of make this pivot away from hardware. Apple has a lot of scale, and they're participating in medical research and all these other things too. And my hunch is they will get to that point where they'll be able to aggregate a bunch of data too, which will also make it, important. And as these features get added to smartwatches, you could see you could see yourself bringing your sleep data from your watch to your primary care physician, checking it in, downloading it. You could do EKGs, you could do what you can already do now. So you can do a lot of things. And I think that highlights where the data goes for not only the healthcare companies, the insurers, Apple, Fitbit, and the patients themselves.
And you talked a little bit about this, Larry, though, but in terms of some of the features of the watches, exactly what the watches will be tracking when it comes to healthcare. Talk about that a little bit more in detail.
I think you are going to see a lot more applications for things like diabetes and chronic conditions. I think the heart information is going to be interesting. And, ultimately, I think there's going to be applications where you'll be able to quantify people down to the point where, I don't know if you get into mental illness or not, but you can certainly get into things like anxiety where there's a heart rate spike. You're already seeing it where there's software and the sensors within the Apple Watch will, notify somebody if you fall. There's AI predicting when you're going to fall. So there's a lot of data that's out there. I think the challenge is just going to be how secure and how private it is, and what that line is where things get creepy with insurers and things like that. But I do think the data from your smartwatch and your wearable and what you track is increasingly just going to be part of the healthcare mix. So, and it might save you more money from a consumer perspective, but it's going to be a fascinating battlefront to see.
So we're definitely seeing Fitbit pivot here a little bit, Larry, if you will. So talk a little bit about that. Or are you surprised by that?
I'm not surprised by the pivot just because I've been following it for a few years now. Fitbit's been trying to do this since like 2015. And they've been working with insurers and companies. So I'm pretty confident they can make that pivot. The challenge for Fitbit, which is what Fitbit actually talked about on their earnings conference call, is just that they still need device sales to do well so they can have that base of users and that, corpus of data that they need. So that's where, so if the smartwatch and the hardware demand and all that stuff dries up, then so is their data, which will hurt, these B2B deals they're cutting on healthcare. So that's where it gets interesting. One thing they did say, though, is they're going to, their average selling prices are going to go down because they are, they will compete for margin, or they will sacrifice some profit margin to focus on market share and getting their devices in the field. And the reason for that is because ultimately it's going to be, the money is going to be made on the data side, software and services.
Definitely producing some interesting data there, Larry, as you mentioned, is when it comes to sleep, it can be a little bit eye-opening to see just how little some of us are actually getting of that. But this is, again, an interesting space to keep our eye on. We appreciate your insight as always. For the full article, check out ZDNet.